Hashtag Ducks Football is presented by the Jerry Wilson Group at Alpine Mortgage Planning.
Welcome back. We brought a fourth to our table. I'd love to introduce Dr. Desai. He's an MSK radiologist for RestorePDX in Beaverton. We use the latest imaging technology to treat and diagnose patients. And the rest of these notes were in your handwriting, but I hear you're a big college football fan. How have you been enjoying the season so far?
I've been enjoying it a lot. My team lost the second game, so a little bit depressing, but we're getting back into the swing of things.
We heard it was the Buckeyes, so we feel for you. But
yeah.
we'll shift gears to a team that's 3-0, unfortunately a little banged up. The Ducks, a myriad of injuries, and let's start with Andre Y. He had a broken tibia, and with that tibia, doctor, people that break it, it can sometimes be a small fracture and sometimes a career-ending injury. What have you seen from those type of injuries?
Yeah, it really depends. I think most commonly in football or sports, we see tibial fractures in the mid-shaft. So the tibia is one of the long bones, especially one of the most supportive bones in the lower leg. So we have the tibia and the fibula. Most of the time in football or sports injuries, we'll see a mid-shaft fracture, oftentimes a spiral fracture. Sometimes there can be some mild displacement. So with those, it's time off, non-weight bearing, usually about a 4 to 6 month return to play. And it really depends. I know we don't have a lot of information on that particular injury, but it can be a mild stress fracture where you're looking at a much short time and some rest and it heals, versus something that's more significant, or if it affects a joint, it can be much more severe, even requiring surgery.
The dreaded 3-letter acronym, ACL injuries, come up twice for two Duck players. We'll start with Tyler Johnstone. He's torn the same ACL twice. And when you see cases of somebody tearing the same ACL a second time, what do you make for the prognosis of someone like that for their long-time return back to football or back to just normal function?
Yeah, it's much tougher. We talked about having repeat injuries before with Carson. And one of the concerns is with an ACL, it's one of the main stabilizers in the knee. A strong ligament, if you think of it as a real strong rope right in the center of the knee. When that tears, we usually reconstruct that with a graft from the patient, from that same knee. And so when that tear occurs again, we worry about, did it happen in the graft itself or where they attached it? So that's one question. Also, where did it, what other injuries occurred with it? You can have a meniscal tear, which is a cushioning, any cartilage injury, so we worry about those things with that instability. The other issue is coming back from a second injury, having that downtime, having the atrophy, then having to rehab again and being down for almost 2 years. It's definitely much, much tougher after that second injury.
We saw an earlier ACL injury with Braylon Addison in spring game. People were saying he was going to try and come back from Michigan State. That's come and gone. When you're a receiver and you're a dynamic playmaker like Addison is, and you're cutting and changing directions a lot more than, say, a lineman like Johnstone, is there anything particular you have to look at when you're doing the rehab, or is there an extended amount of time for an injury like that to a skill position player?
Yeah, it's really important is maintaining flexibility and strength. And so nowadays with the athletes, we also want to do prehab. So right after the injury, there's bike riding exercise, maintaining flexibility. So all those things go into it. A great surgeon, a good surgery is very important. And then at least, from the time of injury, oftentimes we're looking at 6 to 9 months return to play. With the wide receivers, DBs, cutting athletes, that's also extremely important to get them back to plyometrics and dynamic exercise. And so that last part of the rehab is really critical to make sure that they can go full bore.
When you talk about an injury like a ACL, where you said you're doing that prehab, you're walking around, maintaining mobility, versus something like a broken leg where you're in a cast, what's the big difference coming back? And with an ACL, is there a higher likelihood of coming back faster just because you can be mobile and maintain that flexibility quickly after surgery?
Well, definitely it helps if we can do that. Oftentimes, they'll wait a few weeks for the swelling to come down. Mobility is very important, keeping the patella moving. One of the concerns with that is stiffness. And so if we can get through that, usually the prognosis is better. There's earlier return to play. The long-term concern, and also something that we look for, and that's why we use imaging, is making sure that there's no other concomitant injuries or other injuries that occur with the ACL, like an MCL or a meniscus injury or a cartilage injury. That can push out the prognosis or add surgeries to the reconstruction.
Well, thank you so much for dropping some knowledge on us. Dr. Desai is at RestorePDX in Beaverton. You can find him there. When we come back, we'll talk about some healthy Ducks, and we'll return to Pullman, where Aaron Fentress joins us to get us set for the kickoff against the Cougars and to give us his predictions. Stick around. We'll be back.